Follow me, because by the end of this video, you'll wonder how you spent all this time without knowing this important information. Understanding diverticulosis and Diverticulitis-Doctor explains. Don't ignore diverticulosis. You might have heard this word tossed around in medical discussions or maybe even in a doctor's office. But do you actually know what it means and how it can impact your health? Here's a fact that might surprise you. By the time people hit 60, about 60% of them develop diverticulosis. That's right. More than half of older adults have this condition without even realizing it. And yet, most don't even give it a second thought until it turns into something much worse, diverticulitis. Now that's a word you don't want to hear from your doctor. But what exactly are these conditions, and why should you care? Stick with me because you're about to find out everything you need to know to protect yourself. First, let's break it down. Your colon, or large intestine, is responsible for processing waste. Over time, small pouches called diverticula can form in the walls of your colon, usually in the lower part called the sigmoid colon. These pouches develop due to pressure inside the intestine, often caused by a low-fiber diet. When these pouches exist without causing problems, that's called diverticulosis. It's mostly harmless and doesn't cause symptoms in most people. But when these pouches become inflamed or infected, it turns into diverticulitis, a painful condition that can lead to serious complications like abscesses, perforations, and even life-threatening infections. So why does this happen? The biggest culprit is diet. People who consume low-fiber diets are at a much higher risk. Fiber plays a crucial role in keeping stools soft and easy to pass. Without enough fiber, stools become hard and difficult to move through the colon, increasing pressure and leading to the formation of diverticula. In countries where diets are rich in fiber, such as parts of Africa and rural Asia, diverticulosis is extremely rare. Contrast that with Western countries, where processed foods dominate, and suddenly, diverticulosis is rampant. Additionally, lifestyle factors such as lack of physical activity, obesity, and even smoking can contribute to an increased risk of diverticular disease. Let's talk symptoms. Most people with diverticulosis don't even know they have it because there are no symptoms. But when diverticulitis strikes, you'll know. Imagine intense pain in your lower left abdomen, fever, nausea, changes in bowel habits, and sometimes even rectal bleeding. Some people mistake it for food poisoning or appendicitis. If left untreated, it can progress into serious complications like bowel obstruction or sepsis. In severe cases, an abscess can form, which may require drainage or even surgery. You might be wondering, how can I prevent this? The best strategy is simple: fiber, fiber, and more fiber. The recommended daily intake for fiber is about 25 grams for women and 38 grams for men, but the average person only gets around 15 grams a day. Load up on fruits, vegetables, whole grains, and legumes. Hydration is key too. Fiber works best when you drink plenty of water, helping things move smoothly through your digestive system. Regular exercise also helps keep your bowels active and healthy. Reducing red meat consumption and opting for leaner protein sources can also play a role in reducing risk. Now, let's clear up a common myth. Nuts, seeds, and popcorn do not cause diverticulitis. For years, doctors warned patients to avoid these foods, thinking they might get stuck in diverticula and cause inflammation. But modern studies have debunked this myth. In fact, Some research suggests that eating these foods might actually lower your risk. Fiber-rich foods, including these, contribute to better gut health overall, making them beneficial rather than harmful. But what if you already have diverticulitis? Treatment depends on severity. Mild cases can be managed with antibiotics, rest, and a temporary low-fiber diet. More severe cases might require hospitalization, and in extreme cases, surgery may be necessary. In recurrent cases, doctors might recommend a high-fiber diet to prevent future flare-ups and maintain gut health. Probiotics may also help by balancing gut bacteria and reducing inflammation. The good news? With proper diet and lifestyle changes, you can significantly reduce your risk. So don't wait for a painful wake-up call. Start taking care of your gut today. Early intervention and prevention are always better than dealing with complications later.